This is Dr. James, and one of the common things that we see that even as a pediatrician of 26 years that you worry about is a very common symptom of vomiting. Seems weird for that to be something that I'd worry about, but vomiting can be a symptom of so many things. Vomiting can be a symptom of meningitis. It can be a symptom of strep throat. It could be a symptom of appendicitis. It could be a symptom of a bowel obstruction. It can be a symptom of gallbladder disease, mono, leukemia. It can be a symptom of an ulcer, a gastroesophageal reflux disease, a severe anaphylactic allergy. It can be a GI bug. It can be from anxiety. There are so many things, diabetes. There are so many things that can present with vomiting. And so when you're bombarded with this list of possibilities, then you have to sit there and you have to figure out, kind of like an if-then statement, where you sit there and you go, do I worry or do I not worry? And that's really hard for me to teach you because it's something that to this day, when someone walks in with vomiting, I sit there and I go, okay, what's causing the vomiting? And so I'm going to give you just a brief little, do you worry, do you not worry? And so with vomiting, you should never see any kind of mental changes. If you see any type of mental changes where, they're not as conscious as they would, they're not thinking the way that they should be, there's any type of seizure activity, lethargy, can't wake them up, things like that, then of course worry a lot. If you have any kind of vomiting with severe abdominal pain, especially in the right lower quadrant, but is just out of proportion to just some belly pain, just feel bad, definitely be seen. When I see a kid with vomiting, one of the very first questions I'm going to ask is, do you have a fever? If you have a fever, then I can categorize this as something infectious. Whereas if you don't have a fever and you have vomiting, then I have to think about something else. Could it be an obstruction? Could it be diabetes? The next question I have is, do you have diarrhea? I know this is going to sound bad, but when you have vomiting and diarrhea, instantaneously I feel better. At that point, I know that we have an infectious process that is most likely a viral process. And then the next thing I'm going to want to know is, are we having blood in our poop? If we're not having blood in the poop, then I'm most likely dealing with viral. And now I'm going to deal with prevention of dehydration and symptomatic relief. So what do you do as a parent? Well, as a parent, first thing is take care of your kid, clean up the mess, okay? Then see, does it happen again? And then you start asking the questions. Have I been around somebody who's had a GI bug? Has my child been drinking more, peeing more? Has there been any mental changes? Does my kid have a fever? But if your kid vomits more than a couple times and doesn't have any diarrhea, it's probably time to get your doctor involved and to ask them some questions and let them try and figure it out. If you have vomiting and diarrhea and your whole house has vomiting and diarrhea, you have a GI bug. And then it's just, symptomatic stuff. Give them some abdominal rest. Go real slow. Go with clear liquids, really small amounts. Encourage them to rest. Don't let them, overdo it. Don't let them overdrink. Don't let them overeat. A lot of times, you kind of stay away from things that are kind of hard on your belly or hard to digest. The brat diet, bread, rice, applesauce, bananas, lots of, clear liquids. All those things are fine and they all work for those situations. But if you don't see vomiting and diarrhea, and you vomit more than a couple times, or you see any of those things that are worrying, it's definitely time to let your doctor worry, because there are a lot of things to worry about, and it can be a symptom of things that are extremely serious. So let your doctor figure that out. Don't take that on your own. But if you have vomiting and diarrhea, well, that's probably pretty safe for you to watch and to just slowly take care of. Good luck.